Good morning. I'm Liz Horton with the Greenville Chamber of Commerce, and I want to thank you for joining us today for our continuation of our Community Matters series. If you missed the first sessions, you can find the recordings on the Greenville Chamber's website. Over the coming weeks, we'll continue to connect you with local leaders and experts to discuss issues that are top of mind right now. You can tune in on Tuesdays and Thursdays at 10 a.m. and learn more and register at greenvillechamber.org. Just a couple of housekeeping notes. All attendees should be on mute, and you can submit any questions that you have through our chat feature, and we will get to those at the end of our program as time allows. I'm excited to introduce our speakers for today. Joining us on the phone are Mike Harris with Blue Cross Blue Shield of South Carolina. Mike is the VP of Sales and has over 34 years experience in the insurance industry, and is responsible for sales and marketing for large groups, national accounts, association group plans, chamber association sales, and student health plans in South Carolina. And this includes the Chamber's Value Add program. We also have with us on the phone from Blue Cross Blue Shield, Lisa Haddad, who is the South Carolina Chamber Program Marketing and Sales Liaison. Lisa has over 31 years experience in sales and marketing with Blue Cross Blue Shield, with 14 years experience working directly with chambers of commerce throughout South Carolina. Also joining us today on our webinar, we have Tony Kuskalekas, president of Pella Medical Center. Tony joined the organization in September of 2012 and is very active in our community, including serving on the Chamber's Board of Advisors. We also have Dr. Chris Lombardozzi, from Pelham Medical Center. He's the Vice President and Chief Medical Officer and has been practicing emergency medicine for over 20 years. In addition, he has a wealth of experience in emergency management and as a flight physician. And he's also a liaison to the CDC as part of their Hospital Infection Control Practice Advisory Committee. Thank you all so much for being with us this morning. Tony and Chris, I know that you all prepared a presentation for us, so if you would like to start us off this morning.
Okay, well, thanks, Liz. Appreciate that. We're honored to be here, and hopefully this will be helpful to you. We've got a brief slideshow to walk you through some of the things that we've done. So if you want to pull that up so everybody can see and go to the next slide. We're going to talk a little bit about sort of who we are and then what we've done to deal with the pandemic, and then show you a little bit of modeling and what some of our future plans are. I think one of the things that people might be particularly interested in is what does this mean to get the workplace back in business? And we're probably not in position to give you some hard and fast rules, but we will sort of give you some insight into what we're doing as an organization. We'll go through this quickly so we can have as much time for Q&A. Next slide, please. And you can move to the next slide. I think everybody knows the whole healthcare system around the country has been dealing with this pandemic. What you may not know locally, just about Spartanburg Regional Healthcare System, we're a multi-hospital system, 6 hospitals primarily in Spartanburg, Cherokee, and Union counties. But you can see on the slide there, we have a pretty expansive service area. Where we're at here at Pelham Medical Center, we straddle the county lines between Spartanburg and Greenville. We have over 400 physician providers and another 300 mid-level providers in our medical group of the Carolinas Physician Network. Next slide just is a very brief picture of who we are. We can't be in healthcare and not have a little bit of shameless marketing, but this is really more just to kind of give you a sense of what we do. Pelham Medical Center is a 48-bed hospital, again, right on the county line. We are a hospital just like you would think of any hospital. We take care of really most anything any other hospital can, short of major trauma and open heart surgery. Up until this epidemic or pandemic, we've been quite busy and have seen upwards of almost 100 people a day in our ER until this happened. But in any event, we're poised and ready on our campus. We have the hospital as well as the Gibbs Cancer Center and a large medical office building to take care of patients. So we're poised to take care of people around here with this issue and many others. Next slide, please. As a system, we started working together pretty early in the process, and I assume that most every healthcare system in the country has done something similar, although some may have started earlier, a little bit later. But as a system, we work very well to spring into action with a system-wide incident command team that help us um, bring all of our entities together and twice daily talk about a number of things. It really started out as a high-level enterprise just to try to understand, okay, what does this disease mean? What kind of care needs are our patients going to have? What is the federal and state government doing so that we can put together a plan? The other component, as we got a little bit more detailed, was to figure out what each facility in our system needed to do to adequately care for patients. And right now, what we've chosen to do is to try to put folks who are positive with COVID at our Spartanburg Medical Center campus. Each facility in our system will take care of patients until they may need to be transferred. But as many of you probably already know, not everybody needs hospitalization. There's about a 10% confirmed rate and a relatively low, hospitalization rate. Some of the things that we learned early in the process was communication was key, both internally and externally. I think we did an excellent job trying to keep all of our associates informed. In this particular case, as you might imagine, the external environment between media and people in general were clamoring for information. The other things that you see there were things that we had to work through. We, had to spring into action with hopefully finding some childcare options for people, because staff were having to make some quick decisions about how to take care of family when schools were closed and other things. Testing kits is something that we've struggled with, as everybody else has, to have a sufficient supply. I think we've fixed that now, and then we work through just making certain that we had supply and equipment. And as pretty much everybody has done, we've really limited visitation issues. That's been a challenge from an administrative perspective, primarily just because we value compassion, and people don't like being separated from their families. But for everybody's safety and well-being, we have really limited visitation from family and visitors. Next slide, please. Some specific actions that you see on the slide here are, again, our reaction to the pandemic, and ultimately just trying to take care of both our associates as well as the public to make certain that everybody was cared for as appropriately as possible. Again, you can see some of the things that we've done here. Our volunteers, for example, do a lot of work, as they do in most hospitals. We value them, but many of these folks are a little older, and to protect everybody, we just suspended those activities. We did, like many hospitals, cancel elective surgeries and other procedures. That was primarily to preserve what's called personal protective equipment, or PPE. You guys have probably heard that term more than you care. The challenge there is that, we still do some surgeries. There are people who frankly need surgeries. They may not die from not having the surgery, for example, but they really do need it because there's some other deficit going on. So we are doing that. We just are being very selective with how we perform procedures. We have been able to establish some drive-through testing centers, both in Spartanburg and in Cherokee County, and also Union, that have proven beneficial. It's allowed us to preserve our PPE, but also give a central place where people can quickly get testing. One thing you might not know is blood donations really took a significant drop as people began to get concerned around donating blood. So we actually have conducted several blood drives for our associates so that we can help build the blood supply back up, particularly platelets. We have also, just like every other organization, I'm sure, have put together a financial bridge plan that we think is very solid and will carry us through the next couple of months. Next slide. With that, I'm going to turn it over to my friend and our Chief Medical Officer, Dr. Lombardozzi, to talk you through just what the data is telling us and what our plans are going to be for the next month and a half or so. Dr. Lombardozzi.
Tony, thank you, and thank you everyone for being on the line with us. This is my first Zoom call, although I've done a lot of other interviews and conferences lately. And I think towards the end of this, we're going to talk about where we're headed. And clearly, I mean, innovations like using Zoom or using telemedicine in the future are going to play a larger and larger part of what we have to offer. Briefly, this is data as of April 15th. You can see there we've had about 3,600 positive tests in South Carolina, 31,000 negative tests. So as Tony said, it's about a 10% positive for the tests that are performed, recognizing that we're clearly not testing everyone in the state. There have been 107 deaths, and clearly there will be more before this is all over. At our system, we've tested about close to 1,400 people by now. We continue to have our drive-through testing, which has been very well received and has allowed us to funnel people to one location to have that testing done. And by one location, it's really 3 locations, but centralized locations in Spartanburg, Cherokee, and Union, so that if you're at a medical office or you are calling in for a televisit or one of our e-visits and are directed to get testing, it can all be done at one place. And that helps us to provide for the safety of our staff and, again, reduce the use of that personal protective equipment. Next slide, please. We've been using a variety of modeling projections to help us sort out when and where we might use resources. And this is one that we've used. This is out of the University of Washington. There's another out of the University of Pennsylvania. There are a few others out there. And for the most part, they've been pretty consistent in terms of South Carolina projections of a peak resource utilization towards the end of April, early May. I think what's interesting, if you can't read all the detailed print on here, don't worry about it. Look at the big pink mountain that's staring you in the face there. That was the high expectation of where we could have been. And fortunately, due to a lot of the work of folks like you who are on this call, with social distancing, with unfortunately closing down places where we congregate, businesses, practicing good hand hygiene, wearing the masks, what has happened is that we are flattening that curve. And that, you may have heard of that on the news and not quite understood what that means for a healthcare system. But what it really means is that we know what to do to take care of patients, but we needed to make sure that we have adequate staff and resources to do it. And by flattening this curve, you've allowed us to have that ability, that capacity. So when we look at the upstate in general, and just so you know, this is not a competition between us and Prisma and ANMED and St. Francis and the others. We talk on a regular basis, our physician leaders talk on a regular basis to make sure that everybody in the community has the resources that they need. We truly are partnering with all of the facilities that take care of our communities. So you can be assured that we're doing the right thing there. But again, if you look at that curve, that pink line is where we are now, that dotted pink line. And what that means is that we will have enough resources to manage any surge that could come in. So that's all good news. And again, it bears repeating, but thank you all very much. I know that the last month and a half to 2 months have been very difficult, and certainly the next few weeks and perhaps another month or so will continue to be difficult with the business closures. But we really do appreciate it, and it's allowed us to provide safe and effective care. Next slide, please. When we look at these, I've sort of talked through it a little bit. Our peak utilization looks to be on or about April 27th. The social distancing, hand hygiene, all those other measures that flatten the curve, and so it allows us to have the resources that we need. We do, when you look at these projections, however, I think it's important to note that these assume that all those social distancing and other measures will continue through the end of May. That's important to remind people. It's not as though we get to April 27th, we hit our peak resource utilization, and then we say, okay, we're fine, let's everybody go back to normal. And unfortunately, normal will probably take some time. Next slide, please. Next slide. So we'll move on to future plans, and some of this is guesswork. When we talk about things like phasing in of physician offices and elective surgeries, as Tony mentioned, a lot of what we do is very necessary. And if you are a patient who's in pain or who has a delay in their care that would cause harm, we don't want that to occur. So we continue to do the procedures that are essential. We continue to do the procedures that are required for preventing harm. And we'll continue to phase those in over time. As long as we have capacity and we have enough equipment, and again, I keep going back to that PPE, that personal protective equipment that you see on all the news stations. As long as we have enough of that, we can do a lot more work in our hospitals. We have the advantage of having the 6 campuses, so we can cohort the COVID patients in the main campus at Church Street and do other things at the other campuses and kind of keep things rolling. So I imagine we'll see more of that over the next few weeks, if not a month or so. Same thing for staffing. And I think, it bears repeating that the telemedicine, the role of telemedicine is increasing rapidly. We have a couple of offerings. We can use a somewhat delayed telemedicine through MyChart, where you send in an email to your doctor. Those are answered usually within a couple of hours, and recommendations are provided. And that's not just for COVID. That could be for any particular problem that you have. And then we have a telemedicine option, and our physician offices are also using telemedicine now to communicate with their patients and provide care outside of the office setting. And as we look down the road, I think you'll see more and more of that as we've all gotten comfortable with what can be done without someone having to come to a hospital or to an office for their care. You've probably heard a ton about testing. And certainly when this pandemic first got rolling in the United States, it is clear that we did not have enough testing capability. As there were hotspots in Seattle and San Francisco and other parts of California, and then eventually in the New York area, what testing capabilities did exist were sent to those areas. And can't fault anybody for doing that. It makes perfect sense. But it did mean that other areas of the country had a dearth of testing capability for an extended period of time. That has, for the most part, resolved itself at this time. We've got a variety of third-party vendors who do testing, as well as DHEC, but testing turnaround is still in the neighborhood of a couple of days from when you get your test. Antibody testing is something you've heard a lot about. It's not quite ready for prime time, is probably the best way for me to put it. In order to do proper antibody testing, you need to have time. So you test someone or test a larger group of people, find out that they have formed antibodies, meaning that they've been exposed to this virus, they've formed antibodies against it, but then you need to test again to see if having those antibodies makes a difference in whether or not those people are going to get sick if they're re-exposed to the virus. So there's a ton of research going on throughout the world on that, but I don't expect to see anything definitive for at least several months, and more than likely 6 to 12 months. So the jury's still out on that one. In terms of a vaccine, I think that's also somewhat problematic. It will likely be at least 12 months, probably closer to 18 to 24 months before there is a vaccine. And then when there is a vaccine, we also won't know what the effectiveness is of that vaccine until it's been out there for some period of time. So there still remain quite a bit of questions. And that gets to the very last question that I think is on everybody's mind, which is, what does normal look like? And in my mind, normal, at least for now, is not going to look the way it looked a couple of months ago. More than likely, we'll continue to have social distancing for an extended period of time. More than likely, we'll continue to wear masks, at least in healthcare facilities and offices. We will continue to use telemedicine as much and as often as possible. We may continue to have some visitor restrictions, although I imagine we'll be able to loosen those up a little bit based on the situations. And then from a business perspective, clearly there will be a lot of changes over the next several months to year as we all adjust to what's out there. What we don't want to see, and I think from a physician's perspective, what we really don't want to see is a sense of complacency that we've sort of made it through and we're going to be fine and let's all go right back to exactly what we were doing just a few months ago. And our fear would be that the virus is out there, and if we all start to convene again without the appropriate measures, then we will see the spike that we were trying to avoid in the first place. Next slide, please. And at this point, we'll close it and ask for any questions, answers, and I think our friends with Blue Cross Blue Shield have some things to say as well.
Thank you so much. I'm going to switch over to Mike and Lisa for a moment. I know people have had a lot of questions about insurance, and I know that you can only speak to Blue Cross Blue Shield plans, but what should someone do if they think they have been exposed, and is the test covered under their insurance?
Great, Liz. This is Mike Harris. And should a member within any health plan, or even if they don't have coverage, feel that they have been exposed to someone who has the COVID-19 illness, they should seek resources where they can be tested. As our friends at Spartanburg Regional said, there are various sites. They've expanded the sites to do the drive-in testing. The recommendation would be is that you don't go to your regular doctor's office. They are handling other issues in their patients, with their patients. But we've got a variety of resources at Blue Cross Blue Shield that members can use. If you go out to our website, you can actually use Doctor's Care to actually do some of the testing, and then they will send you to the appropriate facility. Then also, as Tony mentioned earlier, they've got various drive-in facilities at Spartanburg Regional that will assist a member to get their testing. The testing is covered at 100%. The member will have no cost share in the liability. So we are encouraging members not to worry about their expenses. We have waived all the cost for the care and the treatment as well, not just the testing. So should a member be diagnosed or have a positive test result, the additional care that member may need, they will have no cost share for the treatment of the diagnosis.
Great, thank you. So what about prescriptions? Can prescriptions be impacted, and can people get more than their usual refill limit during this time?
Great question, and we are getting a lot of calls about that. Right now, there are no impacts of members being able to get prescriptions. We do know the media has made it known that there could be a shortage of particular drugs in the market. We have not seen that. I don't know if our friends at Spartanburg Regional can speak up to that, but we have not seen a concern. What we are seeing, though, is that members that are isolating themselves to avoid going out every 30 days to get their prescriptions have asked if they can get a 90-day script. And for a limited time, we are allowing members that have a 30-day script to extend it to a 90-day script. Basically, we are working with the retail pharmacies just to do the prior authorization with Blue Cross, just to let us know. Because typically that does require a physician to rewrite the prescription in order for it to be dispensed for 90 days. But just due to the current situation we are in, and for a limited time, members can get their prescriptions filled for 90 days.
Great. I know there has been a lot of talk on today's call about telemedicine, and I know that you all recently rolled out a program to expand those offerings for your insurance holders as well. Would you care to share a little bit about that?
Sure, and I can honestly say the best resources, if you go to our website, southcarolinablues.com, and click on the COVID-19 link, there's a whole section there for the 3 options that are available to members. And of course, our Blue Care on Demand option, if you use COVID-19 as a code, all visits are covered at 100%. There's no liability to the member, and it is for all. Anything that they need to call in, pink eye, sore throat, it's covered. And actually, a member that doesn't have Blue Cross Blue Shield can actually use that code and get a free televisit through Blue Care on Demand. The second option would be going through doctor's care. You can use the same COVID-19 code and get a free visit. You do have to be a member of Blue Cross Blue Shield in order for that code to work. For that, and again, that can be for all services, and that could also be for a pre-screening for COVID-19. We are also seeing a lot of physicians now converting their practices over to telemedicine. We are working with them daily to get the necessary credentials approved, but those services also will be covered by Blue Cross Blue Shield for anything outside of COVID-19, just for regular visits. Mental health as well is extremely important. So we are expanding our services. I know the provider community is also restructuring the way that they are delivering care in the community as well, and we're all adapting to that. It's kind of the new norm for right now. So Blue Cross is working closely with our provider community to make sure that we can provide care and treatment to all of our patients.
Thank you, Mike. One more quick question. I know that a lot of our businesses have had to lay off employees, and as a result, a lot of folks have lost their insurance. I know that you all recently expanded some options for individuals who need health insurance during this time. Can you speak a little bit about that?
Sure, and I'm going to let Lisa Haddad, who's also a representative of Blue Cross, to assist me with that response.
Okay.
Sure. Can you hear me?
Yes, ma'am.
Yes.
Okay. Liz, for one thing, I want to make a quick comment on just a spin off on what Mike was saying about the COVID-19 kind of coupon code when you're calling in to Blue Care on Demand. We see it written with the dash in between, so when you're using that code, do not include the dash. So COVID-19 without the dash, and then the services are 100% when you're calling in to Blue Care on Demand.
Thank you.
Secondly, there's an initiative because we know that there are a lot of groups out there that have had to furlough or lay off members of their groups, and employers are having to make some hard decisions. We have an initiative going on now where we're doing an outreach to those employers through their agents to make sure when we notice that there's a group where we can see that there's a lot of members being terminated off of these groups, that there's contact made to those employers and their agents that will offer assistance on where we could place those members, whether it's an individual policy through the ACA, whether it's a short-term plan, Medicare plan. There are some new available options through the individual market where they can actually enroll them like a list bill type of group temporarily. So there are additional options for those folks, whether it be COBRA or state continuation. There are a lot of things we can do. So what we're trying to do is make these members feel confident that they're not going to be left without coverage. And that's one of our main focuses. We don't want any member of ours to feel like they have no safety net. So we are doing a major outreach in that regard to make sure those employer groups know that they do have an opportunity to help their employees.
And Lisa, remind our viewers of the website again.
The SouthCarolinaBlues.com, or they can call their agent or their group rep at Blue Cross Blue Shield, or they can call me. I'll be happy to help any way I can.
Thank you so much. We do have a couple participant questions I'd like to get to before I continue on. We see in the news about hospitals who are beyond capacity trying to keep up with all of the COVID-19 patients. Is Spartanburg Regional anywhere near capacity to treat patients?
Now, we've been very fortunate, and we took measures very early to help add capacity to our system, stopping the non-essential surgeries, finding ways to take care of patients outside of the hospital setting, and then utilizing our satellite facilities as best we could to do that. At one point, we were down to about 50% of our normal volume at our main campus, and that continues to modulate a little bit based on the normal number of people who come in for regular care. So, even today, we're still taking care of people who get involved in car accidents or have a stroke or heart attack or have some sort of other problem that needs to be cared for. And it's important to not forget that we're still continuing with the daily work that occurs in every hospital and every healthcare system across the country. But no, the answer to the question is we have plenty of capacity. We've made hard decisions to do that, but we have plenty of capacity to manage the surge.
All right, another participant question. Has the PPE supply been restored in South Carolina, and do our medical professionals now have all the PPE they need provided to them now?
Yes, so I can't speak to other healthcare systems because I don't know exactly what they have or don't have, but certainly in our system, although we had a few days where we wondered if we'd be okay, we've continued to be just fine. We have a great supply chain leadership team. They have managed to procure everything that we've needed. So we've never had a true shortage of anything to protect our staff or our patients.
Wonderful.
And,
Well, that kind of
Liz,
leads me.
I would just add the community support has really just been outstanding. We have had people offer to make a variety of products, shields, masks, and that kind of thing. But Dr. Lombardozzi's right. We've got good supply leads, but the community support has been incredible to help us in any way.
Wonderful. Well, that kind of leads me to my next question. There's been a lot of talk recently about reopening the economy and how we re-enter and what the new normal looks like. And, a lot of folks are saying that if we do it too quickly, there could be a surge. So how does the healthcare system, are you all prepared to respond should that happen?
Yeah, so again, it kind of goes back to what I was saying before. Ideally, we don't have that surge. We maintain social distancing. We, for better or worse, we're probably going to be wearing these for a while, right? This is a standard procedural mask that we use in the hospital, and we will probably continue to wear those for quite some time, and I don't know how long that will be. We'll probably continue to have pieces of tape when you go into your local grocery store that say, don't stand here or do stand there. We'll probably continue to have meetings by Zoom or other televideo services that allow us to prevent the spread of this should it recur. And then, I touched on vaccines and antibody testing and some of the other things we're doing. Those are down the road. We'll get through this, but in the short term, we're probably going to have to continue to do a lot of the things we're doing now.
Thank you. And I just want to take a moment to thank you and all of the healthcare providers who are on the front lines every day. We just really appreciate all that you guys are doing. For those businesses that are still considered essential, other than healthcare, of course, that are still going to work, or for those who will be returning to work soon, this is for anyone on the panel to answer. What are some ways that they can protect themselves?
So I guess I'll take that one. Again, the most important, there are two most important things. It's this and wash your hands, and wash your hands, and wash your hands, and wash your hands. Pretty much anytime you pick up something, touch something, go to the bathroom, leave your office, wash your hands. The combination of a mask and hand hygiene probably reduces your risk by close to 99%. It's truly amazing what covering your face, and really the reason for that is if I'm coughing or sneezing, it's caught in the mask. And then if I've touched something and I don't touch my face, then it really is going to be hard for that something to get in. This virus comes in through your eyes, through your nose, and through your mouth, mucous membranes. It doesn't come in through your skin. So if you're maintaining great hand hygiene, you've drastically reduced your own personal risk and the risk of your employees and your companies.
In regards to the masks, I noticed that you were demonstrating a few minutes ago. I've seen some folks out that don't always cover both their nose and their mouth.
Yeah,
With the mask?
A few weeks ago, I did an internal video for our system, and as a bit of a joke, I showed all the ways to not wear it. So that doesn't work. Your nose is not covered. We have people who put them on and put them on under your chin. Well, that's great for covering your chin, but doesn't accomplish anything. And then we have people who, you know, do this sort of thing, and that doesn't do much either. So clearly, if you're going to do this, try to do it right. You must have your mouth and your nose covered, and the mask should go under your chin. So it should go over your nose and under your chin. And that way you've covered everything. If you wear glasses, just as a little side note, the glasses should be outside of the mask, not inside the mask like that.
Does that help keep them from fogging up? I know a lot of folks have
It
had
does.
that.
It does. And if you've got a really good seal, then it won't fog. If you're a surgeon or you work in healthcare, you do that. Otherwise, you may have to take them off. But we prefer that you not do that because now you're touching your face again.
Correct. Thank you. Do we have any other participant questions before we conclude? Okay.
Liz, this is Mike. I got one question for the doctor. How frequently should you change your mask, or could you wear your mask all day and still be protected?
Yeah, super question. So most masks can be worn all day, and again, it kind of depends on your situation. If you are out and about all day, if the mask is getting wet or soiled, then it's going to need to be replaced quicker. But if you're sitting in an office like we all are right now, well, for the most part, you can have the mask off as long as there's no one in your office. And then when you go out, you can put it on. So that will extend the use of the mask. Other things that people are doing to extend the use of the mask are to wear the cloth or homemade masks over a surgical mask. That helps extend it a little bit, although one of the downsides to that is that because you're getting more heat out of the mouth and nose, the surgical mask or the procedural mask tends to deteriorate a little bit faster.
Well, that was one of our next participant questions, a couple actually, about how effective are homemade masks. We've seen a lot of tutorials online about making them out of bandanas and different things. How effective are those?
The cloth mask, and probably the best analogy I can give you is if you're looking at a chain link fence from a mile away, you don't see any of the holes in the chain link fence. Well, that's your cloth mask. As you get closer and closer to that chain link fence, you start to see the holes. The virus is small enough to go through those holes. A surgical mask or procedural mask is a much better barrier. Now, that said, if you're not in a healthcare setting where you're essentially protecting yourself from droplets, okay, these are when you cough and sneeze, you produce droplets. You are protecting others by having your face covered, and others are protecting you by having their face covered. So again, what you're doing is just significantly reducing the overall risk. That plus great hand hygiene, maintaining the 6 feet whenever you can, that social distancing, those things, they've already been proven to really reduce the risk and help us all.
Thank you. One last participant question before we close out today. As we restart businesses, has the CDC or OSHA published any guidelines or recommendations regarding employee screenings?
I'm not aware of any new guidelines that have come out from the CDC yet. Historically, the CDC is intentionally vague about their instructions, but we'll wait and see. I imagine we'll probably start to see something from them fairly soon.
Thank you. So, in the words of Mr. Rogers, they say in any tragedy or crisis to look for the helpers. We have a lot of people who want to know how they can help and serve their community. What are some ways that we can all support our healthcare workers right now?
So the easiest thing is to just say thank you. What you guys don't know is that, and I apologize for this, I didn't intend to get teary-eyed here. I've been in emergency medicine for 20 plus years. My wife is a trauma surgeon and intensivist, and we live this life. We chose this life. My greatest fear is that one of my teammates picks up something and gets sick. What has come from the community has been an outpouring of help, of support. I had 2 neighbors this past weekend who came over and mowed my yard. They didn't have to do that, but they did that. And they said, you know, it was the only way they could say thank you. And I can tell you that stuff matters. It really does. So again, I apologize. Thank you.
To take over for Dr. Lombardozzi, I would just echo what he said and just say, you know, thank yous are certainly appreciated. I think caregivers chose the life, but the community support has been outstanding. And we have had so many restaurants and others bring food. We've had, again, people offer to help make products that they believe or know are in short supply. So I think the biggest thing is, like he said, say thank you. And if you are spiritual, pray. But know that we're going to come out on the other side of this. I would encourage the community to not fear. A lot of what we see in the media is sort of this constant negativity, but the healthcare systems around here are well prepared to take care of people. And over time, there's not going to be any fear, I don't think, for people to try to get back to some normalcy and to live their lives. And but in the interim, just think about us, pray for us, and say thank you. And the team's going to continue to be there.
Well, we do thank you and pray. Is there any last messages of hope that you could share with our participants today from our entire panel?
We've got you covered. We really do. We've got the equipment we need to do our job. We know how to take care of this problem as best we can. And again, community's been absolutely fantastic. We'll come out of this better than we went in, and time will tell in terms of how long that will take, but we'll be fine.
Thank you. Tony, any final words?
Just echoing the thank you, and that, you know, using the models that we have, you know, again, from a hope perspective, we don't think this is going to last forever and ever. So hopefully in the coming weeks, we can begin to have some return to normalcy, and certainly government and our health agencies will guide us in that.
Mike, Lisa?
Again, Liz.
Yeah, I would just like to say, you know, I hope everybody stays safe. The social distancing is making a difference, as we've seen in some of the charts. If you are someone who is able to give back, as Tony mentioned earlier, the blood supply and platelet supplies are low, so donate if you can. Help the elderly. If you do have a care worker that needs some assistance in simple things like yard work, as the doctor said earlier, those mean a lot. Supporting your local restaurants, small businesses is extremely important. So when you have the opportunity to do that, and I can honestly say on the back end of all this, we will see a much stronger community, and our citizens will be more well connected. So there is hope on the back end, and I think we're doing the right things. So just continue to do what you're doing. But if you do have the opportunity to support and help others, do reach out.
Thank you.
And I want to say thank you to those healthcare workers that are on the front lines dealing with this. I know that we can do our part by staying healthy, doing the social distancing, wearing the mask in public, and staying out of the hospital so that they can do what they need to be doing for those that are truly ill or who need the surgery, so that we can get back to whatever our new state of normal is. And to remember there are so many people who have lost jobs that we could assist, and those entities that may need, you know, the food banks and sharing God's love and those types of facilities that may need donations. There are many things that we could do, and I have noticed and have been so proud to see South Carolina come together with this. There's so many positives out of this situation, and I know that we'll be much better when we get to the other side. So thank you so much, everyone.
Thank you. I just want to thank our entire panel for participating today and taking time out of your schedules to be with us. We did go over a little bit on time today, but it was some great information that you all have shared with us today. Just want to remind everyone that this recording will be shared on the Greenville Chamber's website, and attendees will also be sent a survey. We encourage you to complete the survey so we know exactly what you want to hear about moving forward and how we're doing so far. Don't forget that this is part of an ongoing series. On Tuesday at 10 a.m., we'll be joined by Lieutenant Governor Pamela Yvette for a discussion on the state of the Palmetto State, and I hope that you will join us. Thank you all again. Have a great day.
Thank you.